Well, hey, everybody, this is Robert, and welcome to today's program. Now, people who are regular cannabis users are at increased risk of experiencing complications after surgery. This is according to a study by researchers with UTHealth Houston. The study was published in a recent issue of JAMA Surgery. And I will go ahead and link to the study in the show notes when I publish the podcast, so you'll be able to check it out for yourself. Well, joining me today to talk about cannabis use disorder and the findings of the study is Paul Potnuru, MD. Dr. Potnuru is the assistant professor in the Department of Anesthesiology, Critical Care, and Pain Medicine at McGovern Medical School at UTHealth Houston, and he is the first author of the study. Dr. Potnuru, welcome to the show, sir.
Hey, thanks for having me. Glad to be here.
You bet. Well, let's go ahead and start out with an important definition and something I've never heard of before until I read your paper was, what is cannabis use disorder?
Yeah, so cannabis use disorder, it was redefined in 2013, and the American Psychological Association is who kind of defines these things. And you can think of it as analogous to any sort of substance use disorder. So, for example, alcohol use disorder. So, cannabis use disorder specifically refers to using so much cannabis that it's starting to have negative effects on your health and well-being. It could be physical or mental. And so some examples of what would qualify as having cannabis use disorder are if you develop things like tolerance, where you need increasing amounts of cannabis to get the same effect, or you have withdrawal. So if you stop using cannabis for a day or two, you start to get physical symptoms like restlessness, agitation, sweating. Or it could even be things like if your cannabis use is starting to affect your job performance or your relationships, these would all qualify as cannabis use disorder. So broadly speaking, it's cannabis use to the point where it's starting to affect you in negative ways, and continued use despite these harms.
So, would it be considered equal or equivalent to addiction?
It's in the same sphere as addiction. Addiction specifically becomes a little more targeted towards the inability to withdraw or inability to stop using a substance. But it's very analogous to having tobacco use disorder or alcohol use disorder. So it's more than just the social, occasional, recreational use, and going into the territory of it's starting to affect your health.
Yeah. So, doctor, why the study?
Yeah, great question. So the impetus for this study was a couple of things. The first big reason is that cannabis is being increasingly legalized across states. And the second big thing is there's increasing use in America and across the world. And a large driver of this increase is people think of cannabis as a relatively harmless substance. And in reality, it probably falls into the same bucket as tobacco and alcohol. And really, it depends on how much you use it that determines how it affects you. So there's increasing use, increasing legalization, increased perception of it as being harmless. And the big driver for this study was recent smaller research studies showing how cannabis users behave differently while they're under anesthesia having surgery. So a good example of that was one study found that regular cannabis users need more anesthetic medication to go under sedation and anesthesia compared to non-users. And another interesting finding was that cannabis maybe helps with pain, so maybe cannabis users will have less pain after surgery. But when they did a research study, what they actually found was cannabis users were needing more opioids after surgery and having higher levels of pain and even higher levels of nausea and vomiting after surgery. So between all these factors, we wanted to see if in a bigger, more national representative data set, we could see these effects. And so that's what we did in the study. We looked at a representative population. So we essentially looked at surgeries that are being done all across the United States from 2016 to 2019. And this is using a federally maintained database that we're able to get national level data. And we split the group into those who had cannabis use disorder and then we had a big group of people who didn't have cannabis use disorder. And then we matched each of these cannabis use patients with a non-cannabis user based on similar other medical problems. Like if we had hypertension and diabetes, we matched them with someone similar. That way we're not overestimating the complications. So that's kind of how this study came about. We have this national data set with new data and all the background that was indicative of a signal that cannabis may cause problems during surgery.
Yeah. In the study and in the press release that UTHealth Houston put out, I want to go ahead and talk about a little bit about the findings and what kind of post-operative complications did you see an increase in with people with CUD?
So the complications we looked at, we were specifically interested in major perioperative complications. So this captures things like heart attacks, strokes, infections, damage to your kidneys, and surgical site-related complications. So that would be like if your wound didn't heal well after surgery and it came apart for some reason, or if you had a hip replacement, if the prosthesis failed for some reason. So these are the major complications we were looking at. So we grouped all these major complications into one category and tried to see if there was a higher rate of these complications in patients with CUD. And after adjusting for all the other medical problems people may have, we found that relatively it's a 20% higher complication rate with CUD. And to put that in context, because relative rates can be a little deceptive, it can sound like a lot. So to put it in a more absolute context, the complication rate was about 6.6% in the non-users and about 7.7% in the cannabis use disorder users. So one way to think about it is for every 100 people that have CUD, one of them might have a complication. And again, to give a little more context to this, these rates are similar to what we find with tobacco use and postoperative complications. So a study that basically did the same study that we did, but with tobacco users, also found about the same increase in risk. So that tells you that cannabis use disorder, although it's considered, or cannabis use is somewhat considered harmless in the public's perception, no one's out there thinking tobacco is a totally harmless and safe substance to use. And the harms associated with it, at least during surgery, seem to be similar to the ones we can see with tobacco use.
So this study really just focuses on CUD patients. This doesn't really apply to the casual, occasional user?
Correct. So not necessarily. That's one of the very difficult things to do in cannabis research is quantify at what point people are becoming heavy users based on how much they're using. Because technically you could be using cannabis every day and not have a cannabis use disorder if it's not impacting your life negatively and you're able to stop at any time without any negative effects. But that being said, the official statistics on CUD are pretty high. So 1 in 5 Americans uses cannabis, and every 3 out of 10 of those users will have CUD. So it's not a small number. And even in our database, we were able to identify roughly 35,000 patients with CUD. So it's a pretty big sample of patients that are presenting for surgery. So with that being the challenge and like defining exactly who has CUD, one of the recent recommendations that's been made is that any cannabis user who's having surgery should have a discussion with their surgeon and anesthesiologist and other doctors about the type of cannabis they're using, how much they use, and how often. Because moving forward, that's really going to help us figure out, is there a safe level of cannabis use? Is there an unsafe level? And what's that safety margin?
So is this a new situation? Is this because the THC levels are so much higher today, or?
Oh, yeah. So that's one of the definite drivers. So interestingly, the potency of cannabis itself, so the cannabis plant, the amount of THC it has been steadily increasing since the early 90s. So year on year, there's a steady increase. And with the proliferation of things like edibles, which can have pretty high THC content, people may be getting more cannabis and the active component THC than they might think they are. So that's another big challenge in figuring this stuff out, is people don't actually exactly know how much cannabis they're ingesting. So they may be ingesting very high levels without knowing it, and probably developing CUD faster than they think.
Yeah. Well, as I said, your specialty is anesthesiology, and you talked about issues with anesthesia with
Yeah.
CUD patients. Were there any other specific issues with CUD and anesthesiology?
Um, yeah, the main ones are the most interesting one definitely is that these patients, so there's definitely some benefits to cannabis use, and that's obviously why people use them, right? So it can help relieve things like anxiety and make people, um, um, and even with pain when they're not having surgery. So these have been started to be tested in research studies, because the thought was, hey, maybe people are using cannabis leading up to surgery. They might have lower levels of anxiety, lower levels of pain. But because of the changes that cannabis causes in the body, that hasn't necessarily turned out to be true. Um, so cannabis, the other thing about it is that it affects all organ systems. So it affects the brain, and that's how it causes the anti-anxiety and pain properties that it has. But it also affects things like the cardiovascular system. So it can make your heart beat faster. It can cause spasms in your blood vessel, and that's how it leads to increased risk of heart attacks. Or cannabis can suppress your immune system. So that can be helpful if you have things like an autoimmune condition, and maybe the immunosuppression actually helps you. But when you're having surgery and the body's stressed out, having immunosuppression can lead to increased infections after surgery. So one of the interesting things about the study was that a lot of the effects that we saw were actually predicted based on older studies that were predicting based on, causing blood vessel spasms or immunosuppression or irritation of the lungs, we will see increased complications, and that panned out in our study. And the other finding that supports all this is that cannabis use disorder patients had higher hospitalization costs. So after we adjusted for everything, they had the same duration of hospitalization. So CUD versus non-CUD, their hospital stay was about the same, but the cost of hospitalization was higher in CUD patients, meaning that these complications we were noticing probably caused increased resource utilization. If you have a heart attack or a stroke, you'll probably end up in an ICU, and that's going to be increased costs. And just in practice, we noticed that cannabis use disorder patients behave a little more unpredictably in terms of the amount of medications they need. So we end up giving more than we think we need to. So it would be great to know this information beforehand and have this in the back of our mind as we're tailoring how much medication we give to a patient. So if we know someone's a heavy cannabis user, we'll probably err on the side of giving them a little more anesthetic than we would.
And all these large numbers of patients used in your study, was there any fatalities linked to this?
Mortality, there were a few cases of mortality. Overall, the mortality rates were uh, pretty low.
Yeah.
And that's really a testament to how safe anesthesia and surgery is nowadays compared to even just a couple of years ago. Uh, but the mortality rate was slightly higher in the cannabis use disorder group, but not enough to be statistically significant. So it was higher in an absolute sense, but we cannot say with confidence that it's for sure higher. And we kind of grouped mortality into the overall complications, so it contributed a little bit to that. I think it was somewhere around 8 deaths in the CUD group and 2 in the non-CUD group.
Mhm.
But overall, the rate of mortality with elective surgery in the United States is very low now,
Correct.
which is great.
Yeah. Now, your findings raise concerns about the safety of cannabis use among surgical patients. Doctor, do you have any recommendations for healthcare providers and/or patients?
Yeah, the biggest recommendation is to follow the recent American Society of Regional Anesthesia guidelines, which say that when providers see patients who are about to have surgery and they recognize that there's cannabis use, to screen them for it. So, for a lot of patients, the first time they're entering the healthcare system as adults is when they have surgery. So there may be patients who are using cannabis, but they don't really see a doctor. Let's say they broke a leg and they need to have surgery. this would be a great time for a doctor to engage them in a conversation about cannabis use and talk about its safety and maybe its harms and its benefits, just like they would any other drug or alcohol or tobacco. So the biggest takeaway for providers is, if you recognize cannabis use, screen them and be systematic about it. So quantify how much and how often they're using it. And for patients, the big takeaway is have an open discussion with your healthcare providers about your use. And it may turn out that if you're a high-risk patient who's about to have a high-risk surgery, that may be a good group of people to say, hey, cannabis may be marginally beneficial for you, but it may be really harmful because you're a high-risk sick patient having a serious surgery. So maybe cut back on that use before. And really moving forward, it's just kind of trying to figure out who it helps, who it hurts, and giving good advice so people can make informed decisions.
Yeah. Let me go ahead and close with this. Any plans for any follow-up research on what you've done so far?
Yeah. So one big limitation of cannabis research is it's a Schedule I drug in the United States federally, which means it's, at least according to the federal government, it doesn't have any medicinal purposes. So it's extremely hard to study without getting exceptions for it. So it's very hard to do any sort of prospective studies where you give cannabis and not cannabis. So unfortunately, nothing like that is going to be done, at least in the United States, for a long time. But the things we can study, which we're trying to focus on now. So in our hospital system, for example, everyone who is admitted for anything gets screened for tobacco, alcohol, and drug use. And part of the cannabis screening now is to include the type, the frequency, and the amount. So moving forward, the big research that we're going to work on is quantifying how much people are using and tying that to complication rates and harms, and even maybe benefits. If low levels of cannabis use may be beneficial for anxiety and pain, and maybe high levels are the problem. So really drilling down the details of how much people are using and how often, and how that's related to their health.
Well, very good. Again, the study is called Cannabis Use Disorder and Perioperative Complications. And my guest today was Dr. Paul Potnuru. And I appreciate it, sir, for sharing your time and expertise with us. Thanks a lot.
Yeah, thanks so much for having me. This was great. Thanks, Robert.
You bet.